Hey everybody, this is Nurse Eunice, and in today's video, we're going to be discussing pressure ulcer prevention. What can you do as a CNA or a caregiver to make sure that your patients do not develop pressure ulcers? And as we do in each of our videos, we'll give you about 10 seconds to receive your notifications. And hello everybody, good morning. All right, so hi again, this is Nurse Eunice and welcome back to our channel. Today's video is about pressure ulcer prevention. Yes, we're going to be doing another practice test. This one's created specifically for CNAs, caregivers, nursing students, our future healthcare heroes like you, because pressure ulcers, also known as bed sores, can lead to serious infections, pain, and even hospitalizations if not prevented early. And so having a great caregiver means that our patients receive better care and are less likely to receive pressure ulcers. As frontline caregivers, CNAs play a critical role in preventing these injuries by turning, repositioning, and recognizing early signs. Excuse me. This quiz will help you test your knowledge and sharpen your skills so you can give your patients the best care possible. And now let's dive in and see how much you know. And don't worry, if you don't know this information, it is okay because I'll walk you through the answers and the rationales. And even though I don't have it on this slide, you all, don't forget every Tuesday night at 9 p.m. Eastern Standard Time, there is a video I will come on live. It's called Night Shift with Nurse Eunice. Go to our YouTube channels, which are shown below, so that you can join. And so if you've passed your test, you have questions about nursing school, you need career advice, I am here to help you. So I'm more than just your online instructor. I'm also your online friend. All right, everybody. So let's get started. Go ahead and grab your paper and pencil because it's quiz time. Pause if you need to take notes. Even though this is live, you can still pause and you can catch up just by moving or advancing the slide on your computer. Drop your scores in the comments. Like this video if it helps you. If you find value in the content that I share with you, do more than just like the video. Go ahead and subscribe, you all. We are so close to 1 million subscribers, and we're going to get there with viewers like you. All right, and there's my YouTube channels. You have youtube.com/Florida Training and youtube.com/Eunice Mathis. And look, I know you love freebies. And if you love freebies, you got to go to my other page. That is nurseeunice.com. Scroll down to the bottom. Baby, I got like CPR study guides, ACLS study guides, CNA practice tests. You're never going to be bored with me. All right, so here we go, team. Question number 1. What is the primary cause of pressure ulcers? Is it A, poor nutrition, B, extended pressure on the skin, C, lack of exercise, or D, dehydration? Revealing the answer in 3, 2, and you are right. It is B. Pressure ulcers are primarily caused by prolonged pressure on the skin, which restricts blood flow and leads to tissue damage. Number 2. Which areas of the body are most susceptible to pressure ulcers? Would it be A, forearms and calves, B, abdomen and chest, C, bony prominences, or D, upper arms and thighs? And we'll give you about 5 seconds to think this through. All right, so 5, 4, 3, 2, and I see a lot of correct answers coming through. You all, it is C. So bony prominences, say that word with me, bony prominences, such as the heel, sacrum, and the hips, those large joints, that is where a pressure sore is more likely to develop. So let's go ahead and read the rationale. Bony prominences are more susceptible to pressure ulcers because these areas have less cushioning from muscle and fat. Plus, your patients are laying on those areas. So stay to the end of the video and you will see the main pressure points. Question 3, how often should a patient be repositioned to prevent pressure ulcers? Is it A, every 2 hours, B, every 4 hours, C, every 6 hours, or D, once per shift? And if me reading these questions and answers to you is helping you to better understand the concepts, and we get questions all the time, Eunice, you're in Florida, can I use your test or, your practice test in California, New York? The answer is absolutely yes, because what I'm teaching you is globally recognized care concepts. So you can use our test in any state. If there is something that is state specific, I will indicate that in my video. And don't forget that whenever you take your CNA test, you can ask for an audio test that will read the questions and answers to you. Use those resources. Question 3, the answer is A, every 2 hours, and PRN as needed. So repositioning every 2 hours helps to relieve pressure on vulnerable areas and maintain adequate blood flow. Number 4, what is the first stage of a pressure ulcer? Is it A, full thickness skin loss, B, partial thickness skin loss, C, non-blanchable erythema of intact skin, or B, subcutaneous fat that may be visible? And that was a lot of terminology, so take some notes. And if you don't understand what it means, just go back and look it up online. And if you're using ChatGPT, always ask for it to cite its resources because it will hallucinate and give you a fake answer. All right, so question 14, what is the first stage of a pressure ulcer? That would be stage 1, would be C. So stage 1 pressure ulcers are characterized by non-blanchable erythema or redness of intact skin. And I like to put this one here because textbooks generally do not show brown-skinned individuals. And so if if you don't understand that a pressure sore on someone who's darker skinned is going to look different than someone who is fair skinned, you are going to put those who are darker skinned at increased risk of injury and tissue death. So as a reminder, those with darkly pigmented skin may not have visible blanching, and then color may differ from the surrounding area. So for you, that may just look like a bruise, but that's actually a stage 1 pressure sore pressure ulcer on someone who's dark skinned. So we all have skin. It's just that textbooks usually don't show injuries or enough brown people. All right, I'll get off my little tangent now because I am making sure that education is more diverse and inclusive. All right, so question 5. And I wanted to just kind of protect that image. And so that's why you can't see everything on the image, but just pay attention to their legs and how they are bent. So question 5, your patient is contracted. That means those joints are stuck. What device can help reduce pressure on the skin? Would it be A, heating pads, B, foam wedges, C, mechanical lift, or D, elastic bandages? I see on this one we're a little torn. And I do want to tell you that I threw a distractor in there. The fact that the patient is contracted, while that is important, it really doesn't aid or help you determine which device you're going to use in order to reduce pressure on the skin. Because in most of your facilities, when you have somebody who's bedbound and who needs to be repositioned frequently, we use pillows and B, foam wedges. You would not be using a mechanical lift unless you were transferring them from one destination to another. For example, from the bed to the chair. So if you need to reduce pressure while someone is still in the bed, foam wedges can help redistribute pressure away from bony prominences, thus reducing the risk of pressure ulcers. Now, when we go back to this previous picture, you would want to try to put a pillow between the inner knees and also the inner ankles because they can start developing pressure sores where the knees are touching each other and where the toes are touching each other. All right, so I hope you learned something. If you did, give us a thumbs up, put it in the chat. Let's go to question 6. What is a key nutritional factor in preventing pressure ulcers? Is it A, high carbohydrate intake, B, reduced sodium intake, C, low fat intake, or D, adequate protein intake? And I love you all, and I thank you all for studying with me. And you all send me such encouraging notes. And I want to let you know that even though I may not respond to all of them, I try to, and I do read them. And I thank you all. Yes, it is D. It is adequate protein intake. So if you have a patient who maybe they don't have their dentures, or maybe they have had chemotherapy and food just doesn't taste right, and they do not want to eat meat, I need for you to encourage the protein supplements. And of course, you need to let your nurse know. And if your nurse doesn't already know and there's not already an order present, he or she will contact the physician, we'll get nutrition, we'll get a dietitian in there, but more than likely there's going to be some supplements that have protein. And so you can help them prevent pressure sores just by reminding them to drink their boost. So adequate protein intake is essential for skin repair and maintenance, which helps prevent pressure ulcers. Great job, team. Question 7. Which tool is commonly used to assess the risk of developing pressure ulcers? Is it A, Glasgow-Coma scale, B, Braden scale, C, Apgar scale, or D, Morse-Fall scale? And this one should be new for a lot of you all. And I'm so proud of you for being here learning. And if you chose B, you're absolutely correct. It is the Braden scale. So the Braden scale is specifically designed to assess a patient's risk of developing pressure ulcers. And so what is it evaluating? Things such as sensory perception, moisture, activity, mobility, nutrition, friction, and shear. And so if your patient has no limitations, well, they are going to, be less at risk of having or developing pressure ulcers. However, if the patient is completely limited, they're going to be more at risk for pressure ulcers, and therefore we have to monitor them more closely. Number 8, what should be applied to dry skin to help prevent pressure ulcers? Is it A, alcohol-based lotion, B, moisturizing lotion or cream, C, antibacterial ointment, or D, talcum powder? All right, revealing the answer in 3, 2, and that is right. B is the correct choice because moisturizing lotion or cream helps maintain skin hydration and elasticity, reducing the risk of pressure ulcers. 9, which of the following is a sign of a stage 3 pressure ulcer? Is it A, intact skin with redness, B, partial thickness skin loss, C, full thickness skin loss with visible fat, or D, exposed bone, tendon, and muscle? So we know what a stage 1 was. A stage 1 was the non-blanchable area with erythema. Now, what do you think stage 3 is? It must be worse than stage 1. All right, and you are correct. It is C. So stage 3 ulcers involve full thickness tissue loss where subcutaneous fat may be visible, but bone, tendon, or muscle are not exposed. And here on the next slide, we have the different stages of pressure ulcers. And so just to recap, stage 1 is non-blanchable erythema. Then stage 2 is partial thickness involving the epidermis or dermis. Stage 3 is when it's deep into the subcutaneous and or the fat layer. And then stage 4, right, this one right here has eschar. It has tissue on top. So you really can't see what's beneath it, but your doctors will debride it. And when they debride it, when they remove that extra tissue right now that's covering it, sometimes there is a cavity and ulceration within the patient's body that can go all the way down into the muscle, the bones, and or the tendons. And so this is why we have to stop it. If we prevent stage 1, we can prevent stages 2, 3, and 4. All right, our next one, team. Question 10. How does incontinence contribute to the development of pressure ulcers? A, it does not contribute to pressure ulcers. B, it causes dryness of the skin. C, it promotes skin elasticity. Or D, it increases moisture and leads to skin breakdown. And I think that this one is an easy one for caregivers like you are healthcare heroes. You know that you have to provide incontinent care quickly because D, it increases the risk of skin breakdown, which can lead to pressure ulcer development. Question 11. What type of mattress is recommended to prevent pressure ulcers in high-risk patients? Would it be A, a waterbed, B, air-filled mattress, C, standard hospital mattress, or D, feather mattress? All right, and we're revealing the answer in 3, 2, and yes, it is B. Air-filled mattresses help to redistribute pressure and reduce the risk of pressure ulcers in high-risk patients. And so the standard mattress that's on the bed, some of them are aerated. They do have air that flows through them. However, when your patient has multiple pressure ulcers, they're usually going to order a specialized bed. And as a CNA, you would be helping to transport that bed into the room if necessary. And then you'll be helping to transfer that patient from the standard hospital bed over to the bed that helps to prevent pressure injuries and pressure ulcers. All right, so question 12. The National Pressure Injury Advisory Council updated medical terminology to better reflect the stages of skin damage caused by pressure. What is the most accurate and current term used to describe both intact and open pressure related skin damage? Is it A, pressure injury? It includes all stages of damage from intact skin to open wounds and is the most updated term. Would it be B, pressure ulcer? It's the newest term that refers to early stage skin damage only. C, decubitus ulcer. This is the recommended term used for all types of bed sores. Or is it D, skin breakdown? This is the medical term now preferred for all pressure-related injuries. So which of the following is true? Which term is the most current term? I'll give you about 5 seconds. And remember, you can always pause. All right, revealing the answer in 3, 2, and it is A, pressure injury. Look, I've been a nurse now for 26, I think we're going on 27 years this year. And so for me, I keep saying pressure ulcer. However, I know better. I know that the most current term is pressure injury, which was changed in 2016. And so, pressure injury officially replaced the term pressure ulcer to reflect the fact that damage can occur even when the skin is intact, such as stage 1 injuries or deep tissue injuries. The term pressure injury now includes all pressure related damage, not just open sores, making it more clinically accurate. Pressure ulcer and decubitus ulcer are older terms, hint, 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 your old nurse Eunice, and skin breakdown is too vague for medical classification. So anytime going forth you hear me saying pressure ulcer, do know that I'm going to try to correct myself and say pressure injury. All right, so what is the role of a skin barrier cream in pressure injury prevention? Is it A, it increases skin dryness, B, it forms a protective layer to prevent moisture-related skin damage, C, it enhances skin elasticity, or D, it disinfects the skin? What is the role of skin barrier cream? And I see some of you all putting in the chat that you have passed your examinations. I am so proud of you all. Look, I need you all to give us some 5-star reviews. Go on Facebook, go on Google, find Florida Training Academy. Go ahead, let people know how much you appreciate us. So in addition to being our YouTube subscribers, other people will be able to find us, especially our local customers. And so for question 13, the answer is B. Skin barrier creams form a protective layer that prevents moisture-related skin damage, thereby reducing the risk of pressure ulcers. 14. Which stage of pressure injury involves damage extending into the muscle, bone, or supporting structures? And this should be easy because we just read it. Is it stage 1, 2, 3, or 4? That's right, that's right, that's right. It would be stage 4. So, stage 4 pressure injuries involve full thickness tissue loss with exposed bone, muscle, or supporting structures such as the tendons. 15. All of which contribute to the development of pressure injury except A. Immobility, B. Frequent repositioning, C. Moisture from incontinence, or D. Poor nutrition and hydration. And you're absolutely correct. You chose the correct response. So the following, which one does not contribute? And the one that does not contribute would be B, because frequent repositioning is a preventative measure. That's what you're supposed to do. So that's not a contributing factor for pressure injuries, because repositioning helps to relieve pressure on bony areas and improves circulation. In contrast, immobility reduces blood flow. The blood can just sit there and clot. They're not getting good circulation. Poor nutrition slows tissue repair. Remember, we said they need protein. So if they're not eating and they're not drinking, they're going to start having muscle waste. And when the muscle gets weak and the skin also is going to deteriorate, they're going to be more likely to develop pressure injuries. And then moisture is also a risk factor because moisture weakens the skin integrity, increasing the risk of skin breakdown. 16. How can friction and shear be reduced to prevent pressure injuries? Would it be A, use rough bed linens? B, elevate the head of the bed to 90 degrees? C, use sliding sheets and lift devices? Or D, frequently massage bony prominences? All right, so we're trying to reduce friction and shear. In other words, this patient's skin rubbing on this bed. Okay, and so if we want to prevent friction and shear, we're going to do C. We're going to use those draw sheets. We're going to have two-person lift. If that's not available, we'll use our Hoyer lift device. So using sliding sheets and lifts devices helps reduce friction and shear force that contribute to pressure injury development. All right, and if you're just tuning in, I'm trying to trick my brain, and instead of saying pressure ulcer, which is the old term, anytime you see ulcer on the screen, we are going to say injury instead. All right, so 17. A resident has a skin tear on their arm with a loose flap of skin. What is the best action a CNA should take while waiting for the nurse? Is it A, remove the skin flap and stop the bleeding with gauze? B, clean the wound with soap and water and apply a bandage. C, gently cover the area with a clean, dry dressing and notify the nurse immediately. D, tape the flap down tightly to prevent it from moving. And while you're reading that, the reason that I wanted to include skin tears in a video about pressure injuries is because they kind of go hand in hand. When a patient has thin skin and their skin begins to tear, they're more likely to develop pressure injuries. And so if you look at their skin and you're like, uh-oh, this skin doesn't look thick and healthy, you should also be thinking, uh-oh, this person's more at risk of getting pressure injuries. And so if your patient has a skin flap, you are going to do C. Look, we never remove that flap of skin. And as a CNA, that's outside of your scope of practice. So CNA should never clean or remove the skin flap. Your role is to protect it using clean, dry, non-stick dressing and notify the nurse promptly. We have wound care, you all. Our job is to save that skin, but we're not going to use soap and water. We have saline. We have milder items that we can use in order to clean that area. And so you're not going to remove the flap. You're not going to take it upon yourself to clean it with soap and water. Ouch. And you're not going to tape it down, because if you tape it down, we have to remove that tape, and we could also make the pain worse, and we can cause the skin tear to become bigger. Question 18. Why is a regular skin inspection important in pressure ulcer prevention? Is it A, to apply medication, B, to identify early signs of pressure damage, C, to measure body temperature, or D, to clean the skin thoroughly. Why do we regularly inspect the skin? Why do I need my CNAs to do that? And that's right, you geniuses. It is B. Regular skin inspections help identify early signs of pressure damage, allowing for timely intervention to prevent pressure injury development. 19. When is the best time for a CNA to check a resident's skin for signs of breakdown or pressure injuries? Is it A, during mealtime when the resident is most alert? B, at the beginning of the shift before waking the resident? C, only when the resident complains of pain or itching? Or D, during bathing, dressing, or repositioning? Right, and if you made it this far, you've not given us a thumbs up, go ahead, help a nurse out. Give us a thumbs up. All right, so question 19, the answer is D. So as a CNA, you're not going to just walk in their room before you wake them up and start looking at their skin. Rude. You're not going to interrupt their meal time to look at their skin. Rude. What you're going to do is you're going to check the skin while you're providing care. So during bathing, dressing, perineal care, if you get them up to the toilet, that gown opens in the back. You can do a quick skin assessment. So these tasks give the CNA a clear view of the skin and bony areas where pressure injuries can develop. 20. How does adequate hydration contribute to pressure injury prevention? Is it A, it keeps the skin dry? B, it improves blood flow and skin elasticity? C, it reduces the need for repositioning? Or D, it thickens the skin? What role does adequate hydration play? That's right. Great job. It would be B. Adequate hydration improves blood flow and skin elasticity, which helps in preventing injuries. Question 21. What is the recommended angle for elevating the head of the bed to reduce the risk of shear? Is it A, 90 degrees, B, 45 degrees, C, 30 degrees or less, or D, 60 degrees? And just go ahead and give us a guess, even if you don't really know the answer or you don't even know what we're talking about right now. I'd rather you guess. Remember, when you're taking your examinations, if you don't choose anything, you have 100% chance of answering it incorrectly. But at least if you choose one of the four options, you have a 1 in 4 or a 25% chance of selecting the correct response. And so you all, for question 21, the correct response is C, 30 degrees or less. So elevating the head of the bed to 30 degrees or less helps reduce shear forces that contribute to pressure ulcer formation. But let me tell you this, this is great for textbook, but we're caring for humans holistically. And some of our patients, they may have underlying health concerns besides being at risk for pressure injuries. And so if they have respiratory issues, they're not going to be comfortable at 30 degrees. So what we do is we just try to find a happy medium. If someone has a pressure ulcer on their hip or on their heels, it's not good to have them up at 90 degrees the entire time because you're putting more pressure on the bony prominences. And so these red dots represent pressure points. And so the lowest level that your patient can tolerate. And so textbook is 30 degrees or less. But let's say that your patient, because of their breathing issues, can only tolerate about 45 degrees. That's fine, you all. And don't forget to reposition them every 2 hours. And for those heels, you would offload them. You would put them on pillows. And so, yes, textbook is 30 degrees or less, but we're not taking care of books. We're taking care of humans. And so try to make your patient comfortable while also reducing the risk of pressure injuries. 22. Which condition makes a patient more prone to pressure ulcers? Is it hypertension, diabetes, hyperthyroidism, or asthma? Which condition makes a patient more prone to pressure ulcers? We're torn. We're torn. Is it A or B? Is it A or B? And you all, it's B. That's right. Remember those diabetic ulcers? So diabetes leads to poor circulation and impaired healing. It takes them longer to heal, thereby increasing their risk of pressure injuries. 23. Why is it important to avoid massaging bony prominences? A, it can cause tissue damage and worsen pressure injuries. B, it can increase blood flow to the area. C, it is a waste of time. D, it makes the skin more elastic. So why is it important to avoid massaging bony prominences? And what made me put this question is I remember about 4 years ago, one of our CNA students contacted me because her nurse insisted that she massage someone's tailbone because the tailbone area was painful. And she wanted to know why I taught her one thing, but her nurse was teaching her something different. And so I told her, when in doubt, you need to go look up evidence-based research. And I asked her to share that with her nurse because according to current standards, we do not massage bony prominences. So bony prominences can cause tissue damage and worsen existing pressure ulcers. So if it's already thin there's not a lot of fat, there's not a lot of muscle, and you take it upon yourself to start massaging it because in your mind, you're increasing blood flow. But what's really happening is you're increasing tissue damage, aka pressure injuries. And so the current standard is we do not massage bony prominences. And I love this sign, just say no. When in doubt, evidence-based research. Go look it up online. It's usually free, and you're going to find the current standard for whatever topic it is you may be questioning. 24. A resident refuses their scheduled bath and says, "Ma'am, I am clean." Why is it still important for the CNA to report the refusal to the nurse? A, because the CNA may be written up for not completing a bath. B, because refusal of care may indicate a behavior problem. C, because bathing is also an opportunity to assess the resident's skin for injuries or changes. D, because all residents are required to bathe daily by facility policy. So this patient says, "I'm not taking a bath. Y'all keep harassing me. I know I'm clean. I don't stink." But as the CNA, that's not your out. You still need to go ahead and report it. Why? Yep. That is right, because you didn't do your skin assessment. Now that's going to get that nurse in there to do that skin assessment. So bathing is not only about personal hygiene. It's also a vital time to observe skin for redness, pressure injuries, rashes, bruises, or other signs of decline. Reporting a refusal ensures the nurse is aware that this important assessment opportunity was missed. Great job. 25. Which intervention is not helpful in preventing pressure injuries? Is it A, keeping the skin clean and dry? B, using pressure relieving devices? C, encouraging mobility? Or D, limiting the patient's fluid intake? This was tricky. Which is not helpful? And I know what you're thinking. You're thinking, well, if I don't give them fluids, they won't have episodes of incontinence, and then they won't be at risk for pressure ulcers. And wrong answer, false. So D is not helpful. First of all, we cannot restrict the residents' fluids without a doctor's order. They must have a medical reason for us to restrict their fluids. You limiting a patient's fluid is not helpful, and it can actually contribute to dehydration, which means their skin is going to be dry, which increases the risk of pressure injuries. And so they need fluids, just like you're putting lotion on their skin. Well, that's not enough if they're dry, throughout their entire body internally. So lotion on the outside, water on the inside, and that's going to help prevent pressure injuries. And my team, my friends, my family, I love you all so much. And so if you go to our website, which is fltraining.com, and click on our online course tab, there's 3 lines in the right upper hand corner, which is our menu. You can see our online CNA course, and you can see our other online courses too. And so this is not a certification course. This is a course that's going to prepare you for your certification, regardless of where you are located. And it includes a test bank, you all. So we have hundreds of questions that you can practice. You can get your score at the end. And so if you're interested, go to fltraining.com, and don't forget about nurseunits.com for those free study guides and more. I appreciate you all. If I'm not on here on Monday, I will definitely be on here on Tuesday at 9 p.m. Eastern Standard Time for Night Shift with Nurse Eunice. So you all have a blessed day, a wonderful weekend, and I'll see you in the next video.